My name is Megan Davis, and I am an occupational health specialist who used a hazard analysis data sheet to determine the hazards and exposures in the machine shop at UNE. The purpose of my job is to find any connections between specific exposures and adverse health outcomes within various work environments. With that being said, before we get started, I would like to go over a few simple definitions before I go over the identified hazards and the following recommendations to improve the working environment at the machine shop. So, occupational exposure is defined as the physical conditions, physical stress, physical agents, chemicals and biological agents, and psychosocial stressors. A few examples of these exposures include lights, heavy lifting, dust, solvents, noise, vibration, and bacteria. Occupational health is defined as an exposure that may influence health, and hazard identification is defined as the process of determining whether exposure to an agent can increase the incidence of health conditions. And last but not least, job hazard analysis is a technique that focuses on job tasks as a way to identify hazards before they even occur. Alrighty, with that being said, the cause of morbidity, mortality, and injury in the United States is strongly related to occupation and is caused by hazards within the workforce. Examples of fatal and non-fatal injuries related to occupational health include amputations, falls, musculoskeletal disorders, trauma disorders, workplace violence, repetitive motion disorders. The types of occupational injuries can be either intentional, unintentional, or traumatic. Now, moving on to some basic background information in regards to the machine shop. The machine shop is located on the University of New England's campus and employs about 15 full-time employees. 90% of these employees are reported to be males and 10% are females. All employees are between the ages of 30 and 65 years old who work between 6 a.m. to 3 p.m. and are given an hour break for lunch and two 15-minute breaks throughout the day. On a typical day, machine shop employees work on university vehicles that generally consist of service such as changing fluids, tires, and general vehicle maintenance. Incident details consist of 3 back injuries within the past 5 years, resulting in 10 lost days. The machine shop also does not have a safety committee on campus, and no OSHA visits were discussed, therefore no citations exist. Okay, so the purpose of completing a hazard analysis sheet is to find any physical risk factors that could apply. If a risk hazard exists, it must be reduced below the hazard level for the sake of employees' health and safety. Being aware of hazards, exposures, and agents in the workforce is important in order to prevent injury and illness among employees. The picture displayed is an example of one of the hazard analysis sheets which we filled out during the machine shop inspection. So we performed, let's see here. We performed a site analysis last month in order to identify any risk factors and the overall degree of hazard level. There we found several chemical, physical, and psychological hazards in the machine shop. Physical hazard examples include radiation, noise, vibration, and extreme temperatures. We also identified several physical hazards in the machine shop, such as high hand force when utilizing tools that require high repetitive motion, repeated impact such as one using their hands as a hammer more than once per minute, high hand vibrations from utilizing the air hammers on site, high noise levels, which was recorded between 60 and 80 dBs, and a final physical hazard of concern is the physically demanding labor required for the job, which includes heavy lifting and staying in stationary, awkward positions for extended amounts of time. Some other hazards that are presented in the data analysis sheet include psychological strain. This data was collected through employee interviews through the use of a questionnaire. Psychological hazards that cause employees to become stressed, depressed, or anxious in the machine shop include having short breaks, a consistent heavy workflow, and working in a fast-paced environment. All of these factors create psychological stress for employees for working in such an environment. Some exposures that were of concern for the machine shop related to chemical hazards include poor indoor air quality from processed chemicals such as decoats, paints, brake cleaners, penetrating fluids, and lacquer thinners, Exhaust fans are used to encourage ventilation throughout the shop to prevent employees from inhaling these chemicals. So moving on to some recommendations that I have for the machine shop at UNE, interventions that could be used to prevent the major effects from physical hazards include reducing the vibration level on the air hammers, decrease noise level throughout the shop by having one designated area to load machinery, tools, or equipment if possible, altering the air hammers to a safer, lower vibration, or perhaps purchasing new air hammers in general. Earmuffs and safety glasses should also be worn at all times as personal protective equipment, which also stands for PPE, to prevent potential hearing loss or vision damage. In order to reduce physical hazards such as noise exposure, placing rubber mounting underneath machinery to absorb and reduce vibrations is a good recommendation in order to absorb sounds and other vibrations. Another good recommendation is to install absorbing tiles and blankets to floors, walls, and ceilings. Screenings for symptoms for psychological hazards is an intervention that can be also used to diagnose employees of their mental state. Screenings from an outside doctor or nurse would benefit employees to check in their psychological state of mind. This intervention would be a great tool that can be used to assess employees' mental health in attempts to reduce symptoms of anxiety, depression, or stress. Providing employees with adequate health insurance and benefits is another intervention that could be implemented to reduce the effects from these factors. Another intervention that employees can utilize is granting employees with more paid time off or for more sick days or vacation days. If employees were to be offered this, they can use their time off in order to take breaks from stressful work-related situations or duties. One last intervention is to incorporate longer breaks per shift. For example, increasing the break by 5 minutes from 15 to 20 minutes twice a day could benefit employees. Hopefully this would allow the worker to reset the mind and utilize the time wisely to do something that benefits them, whether that is to meditate, take a walk outside, or have a healthy snack, or even converse with coworkers. Last but not least, chemical interventions include using PPEs to prevent inhalation of chemicals. Wearing face masks can prevent lung problems in the machine shops. If these chemical hazards are left uncontrolled, then poor indoor air quality becomes an issue, causing foul odors, skin, and eye irritations. Another intervention is to remove the exhaust fan timer in order to allow consistent and constant airflow throughout the in the machine shop at all times, even when there is no one physically present in the shop. Thank you for your time listening to my overview of the machine shop at UNE and my recommendations to improve the overall worksite environment.